name's Dr. Guy Paton. I'm a periodontist, which is a specialist in gum disease and dental implant surgery. I've known Prashant since around 2000. Prashant finished his specialist studies in Queensland at that time and came and joined us in our practice, at that time the Penrith practice. So Prashant, of course, is a prosthodontist who's a specialist in prostheses, dental prostheses, meaning crowns and bridges. Our interaction has principally been regarding implant therapy. As a periodontist, I place implants surgically. As a prosthodontist, Prashant is placing the bridge work. It's been a fairly long association with Prashant, 15 years or longer. Over that time, I've got to know him as a person, as much as a professional colleague. There's lots I can tell you about Prashant, probably a few things I shouldn't as well, but in terms of his professional features, his professional character, I am very much at ease when I'm working with Prashant on implant cases, and the reason for that is that he puts an awful lot of effort into the pre-operative planning and discussion with a patient. So he's going through treatment options, having examined the patient. Out of that comes a patient who has selected a particular option and has therefore been informed of all possibilities and is happy with the choice that they make. So that's a really important start to patient management, that they know they're getting what they want. Okay. Now, beyond that comes the treatment sequencing, which is derived from the treatment plan. Prashant is really good at being super organised, having the sequences set, so the sort of steps that are required to get a patient to the end result, which of course will be an implant with a crown on it, or a series of implants with a bridge, or indeed a full arch of implants with an all-on-4 type approach. So I'm certainly really comfortable working with Prashant. When we're working with a patient, I know that the patient is wanting that end result. They've selected that. I know that Prashant has put a lot of energy into designing the steps involved, and that the treatment plan is appropriate. There's something I really like about Prashant, and that's his troubleshooting ability. And that's a funny thing to say, but I say to every implant patient before we start that implants are a journey. And although we've got a treatment plan for you that starts here and finishes here, and there's certain prescribed steps, sometimes we have to take a detour. So sometimes we find things along the way that might be an obstacle. For example, taking bridges off natural teeth, we might find that the teeth themselves underneath are rotten, perhaps not usable, and this therefore adds another element to the treatment plan. So the patient is then presented with a scenario that teeth may not be saved, that we were hoping could be saved at the start. Or it might be something else like a poor healing around an implant, and a change in the design of our plan. So the really nice thing, I have to say this, to me, is the biggest feature of Prashant is his troubleshooting ability. If something happens and we take a detour in an implant plan, he will always find a way out. He will always find a way to get to the end point. And another reason I have a lot of confidence working with him, it makes it easy really for me, and it's very confidence inspiring for the patient as well.